Hi, welcome to the 3-Minute Journal Club. These are installments or updates from the Workwell Foundation research team of the current literature. The title of this paper is Assessment of Functional Impairment by Cardiopulmonary Exercise Testing in Patients with Chronic Fatigue Syndrome. This was one of our original articles published in 2001 in the Journal of Chronic Fatigue Syndrome. Myself, Chris Snell, Dean Fredrickson, David Strayer, and Stacy Stevens are co-authors in this first publication. This article was one of the first to do cardiopulmonary exercise testing in patients with ME/CFS. The cardiopulmonary exercise testing in these original trials was performed on a treadmill. The treadmill was approved for use by the Food and Drug Administration as part of the Ampligen trials. The subjects were prepared similar to this picture, ECG electrodes on the chest for measuring rate, rhythmicity, and perfusion of the heart. Blood pressure was taken manually, and then very importantly, for this original paper, oxygen consumption was measured via expired air throughout the bout of exercise. The treadmill protocol, as I mentioned, was FDA approved. For the majority of the trial, the speed of the treadmill stayed constant, and workload was increased by increasing the steepness or the grade of the treadmill until the patient reached volitional fatigue. And again, only data that showed patients had reached maximal exertion are included in this analysis. The patients in this study were all CFS patients. The majority were female. There were a few males, so both males and females were mixed in these original studies. In 2001, both Holmes and Fukuda definitions were accepted for the definition and description of chronic fatigue syndrome. The results are shown here. Peak VO2 is the main outcome variable. For each of the subjects, their VO2 placed them into severity of impairment categories as defined by the American Medical Association. The distribution of the subjects is shown here. Some subjects showing no impairment, but the majority showing at least some mild to moderate and severe impairment based on their VO2. A VO2 max higher than 25 milliliters per kilogram per minute was considered to be low but normal, no impairment. You can see some of the VO2s achieved by the patients within this study were significantly diminished, hence the title for this paper. This was one of the first papers to show the viability of doing cardiopulmonary exercise testing in patients with CFS. It also demonstrated significant diminished exercise capacity as evidenced by their VO2 max. It was difficult in this first series of studies to demonstrate whether that diminishment was the result of the pathology of the disease or from the deconditioning that was associated with the disease. It did show that maximal exercise testing was viable or capable in ME/CFS patients, and at least in this study's respiratory exchange ratio or respiratory quotient was a better measure of effort than was heart rate. As we'll see in some later studies, the heart rate response is blunted in CFS patients. There was a lot of heterogeneity of the exercise testing results, hence the distribution categories using AMA guidelines. And this would be one of the challenges in ME/CFS research, even to today, is the heterogeneity that's demonstrated both by the pathology and some confounding effects from deconditioning. We hope you'll stay tuned for more videos from the Workwell team to follow. Thanks.